Hello, everyone, again. Good morning, good afternoon, or good evening, depending on where you are. And welcome to this information session organized by the Quadripartite on the establishment of the Independent Panel on Evidence for Action Against AMR and an update of the Global Action Plan on AMR. We are going to give ourselves one more minute to get everyone joining. And we will be starting shortly. I still see people coming in. Already more than 100 participants. Thank you, Nelea, for posting in the chat. I encourage you to open the chat window so that you can see that this meeting is going to be recorded and will be made available for those who couldn't attend it live. Your microphones are encouraged to be kept silent to avoid any background noise. We also encourage you to use the chat box to ask any questions or make any comments that we will be discussing by the end of this information session. And if you experience any technical issue, please feel free to message the host directly in the chat assistance. So I see that the people are still coming in, and I think we are going to start. As I said, welcome, good morning, good afternoon, and good evening, depending on where you are, and welcome to this quadripartite information session on the establishment of the Independent Panel on Evidence for Action Against AMR and an update of the Global Action Plan on AMR. This is being organized by the Quadripartite Joint Secretariat, and my name is Javier Yugueros Marcos. I'm part of this secretariat representing the World Organization for Animal Health. And if you can move to the next slide, I'm going to introduce you the rest of the people who will be informing you today, starting with Dr. Junxia Song as Senior Animal Health Officer from the Food and Agriculture Organization of the United Nations, as well as Jacqueline Alvarez, Chief of the Branch Industry and Economy Division at the United Nations Environmental Programme, as well as Kefas Samson, the head of the Multisectoral Coordination and Collaboration Quadripartite Secretariat on AMR. And then last and not at all least, Jean-Pierre Niemasi, Director ad interim of the Quadripartite Secretariat. On the screen, you have the welcome, which will be given by Jean-Pierre, and then we will be moving on to a presentation of the roadmap on the independent panel, the Global Action Plan, ways for the stakeholder engagement, and then we will be moving into a question and answer. So as I said, do not hesitate to start asking your questions or making your comments into the chat box. And with that, thanking you again for coming in, I give the floor to Jean-Pierre. The floor is yours.
Thank you so much, Javier. Good morning, good afternoon, good evening, colleagues. We're actually delighted to have so many participants and stakeholders joining us today. That really shows a great deal of support to the Quadripartite Joint Secretariat work on AMR. Let me first welcome you all to this information session and apologize if we have been too late to come to you after the successful high-level meeting on AMR and a very action-oriented political declaration that we are fortunate to have from last year. And I just want to again say a few about the Quadripartite Joint Secretariat on AMR. Some of you may know that even the political declaration that I mentioned earlier on has really called for formalizing this joint secretariat so that it can conduct its role as a central coordinating mechanism of multi-sectoral response to AMR. As you have seen from the initial slide, we are 4 organizations, FAO, UNEP, WHO, and World Organization for Animal Health. And we have a standing secretariat that is hosted by WHO. I'm fortunate to be the head at this time. And I'm very fortunate to have excellent colleagues who we meet every 2 weeks and whom we are working closely on these priorities we are going to present to you today. Among other functions, we also offer secretariat support to the key important global governance structures of AMR, including the Global Leaders Group on AMR, the multi-stakeholder partnership platform, and soon to come, the independent panel on evidence for action against antimicrobial resistance. Beside that, we are also putting together our knowledge, our expertise from the 4 organizations, and we support member states to implement standards and policies to address AMR in a One Health approach. I would like also to mention that part of our job also includes to manage the Multi-Partner Trust Fund, which is also a funding that is available to support the implementation of AMR plans across low and middle income countries. So I'll not take much time. Today, we're going to present to you the key important actions from the high level political meeting. And these are going to be independent panel and the global action plan. So I would like to call upon Jacqueline Alvarez first to present the roadmap for the establishment of independent panel on evidence for action against AMR. Jacqueline, over to you.
Thank you very much. It's a pleasure to be with you talking about the AMR panel in particular and how the quadripartite organizations we have organized ourselves to deliver. I should stress once more that AMR is a highly dynamic, complex, cross-sectoral and multidisciplinary topic. There is for sure a very much need for coordination, for having a response that it is science-driven, to inform action, but also to really discharge or phase out all the threats that are posed by this topic. This is particularly why the United Nations General Assembly spoke up and recognized very strongly the need to have an effective and an impactful panel, that it is credible, that it is policy relevant, but it's also politically legitimate. So the process that we have put forward as quadripartite is really very, very important to make this UNGA mandate a reality, but also to build on what other panels that are considered very successful are doing. This is critical and essential. If you can please go to the next slide. So the roadmap I was mentioning, what does it do? It outlines the processes by which the quadripartite organizations will facilitate the establishment of the independent panel. And this is for sure in response to the political declaration that I will touch bases very shortly afterwards. And what does the roadmap do? It describes the potential elements that need to be considered for establishing and operationalizing the panel. So it is a two-step approach. One is the real establishment that needs to be happening by end of this year, according to the mandate in the resolution, but also the operationalization of the panel is critical for its functioning correctly. The other thing is that it outlines a process for consultation, which is open, transparent, and you will hear all the details from my colleague from FAO Junxia. She will explain later about this broad inclusive process for consultations with everyone. If you click and look at the QR code, you will get into the roadmap and the page that contains all the information about IPEA. Next slide, please. So this is the mandate. This is what happened in last September 2024. The political declaration that was then afterwards endorsed through a resolution is talking about the importance and inviting the quadripartite organizations to establish a panel that needs to be independent, that needs to be for evidence and action against antimicrobial resistance. And they gave a deadline. The deadline is 2025. So in reality, this declaration is inviting the organizations to facilitate the generation, the use of multisectoral scientific evidence to support member states in the efforts to tackle antimicrobial resistance. This is not minor because in a way what it's establishing is some of the characteristics of the panel as such. United Nations General Assembly, as you know, any political declaration is really heavyweight, and this is something that we are working towards very, very hard and strongly so that we can meet it by the end of this year. So the next slide, please. So the rationale for establishing IPEA, those of you that have been following the discussions know very well, but effective policymaking really needs to rely on robust science and robust evidence. As I was mentioning when I was starting the conversation, AMR data, unfortunately, is fragmented across sectors. It makes it very challenging for policymakers to evaluate, to prioritize, and to act on solutions that are really proven, but on solutions that are also One Health solutions. It cannot be one sector priority over the other. Of course, unless there are certain things that guides discussions into one action or the other one. Systemic approaches are essential, and this is part of what the panel will need to look at it. So effective policy making comes from robust science. There are gaps still that are hindering our progress and that are not allowing us for the right interventions or for fundraising in the appropriate manner, in the appropriate level. Other panels that exist have similar characteristics to what the IPEA needs to have, and the roadmap and the different work that we are undertaking is basing on experience and basing on what things have worked and the lessons learned. So if you go to the next slide, please. So what will the panel need to do? And that's part of the consensus at this moment. It needs to support member states in tackling AMR in a One Health approach. That's a must-have for sure. Nobody or countries can take informed decisions unless they really have a full picture of an understanding of what things are happening. We don't want to propose something or establish something that is using existing resources already, or we are putting forward ideas that will be avoiding duplication. This doesn't mean that collaboration and partnerships are out of the question. It means that we have to really maximize the results and the deliverables of the panel, as we always say. And of course, it needs to be part of the facilitator, needs to be a facilitators for generating, but also using evidence that is multisectoral and scientific. So the next slide, please. So as part of the process and the roadmap, and you will see that in the following slide, we prepared what we called a thought starter, and there are some big questions that need to have an answer. So one is the mandate, the purpose, and the scope of the panel. What are the key issues the panel should address? What are the objectives of the panel? Will it have functions that are writing reports? Will it have a function that will be horizon scanning and knowledge management? Will it be in a way supporting policy? How? But one thing that we know is that the panel, as an independent panel, should not be policy prescriptive, but it should give orientation, and that is given by the functions. What is the model that is the best model to have? The experience is telling that intergovernmental panels are really powerful at the time of the pick up of the results and the deliverables. It really shows the cognition and the desire of moving an agenda forward. And that does not collide at all with being independent. Independent can be intergovernmental, as the IPCC, as the IPBES are, the climate change and the biodiversity panel. What is the governance and the structure? That it's also something to be discussed. What are the modalities of work, and what are the rules of the engagement that is needed to be defined prior, so that we don't get into a black hole afterwards. And of course, the issue of resourcing and sustainability is really critical and essential. The next slide, please. So here it's the road and the roadmap that started, and we are just finalizing the landscape analysis. So what is the landscape analysis? In reality, is the document that will provide the factual background on how the panel needs to be, in a way, established, run, the concepts that I was mentioning before, the use of the lessons learned from other panels, and of course, specific governance structures, size, costs, scopes, and functions that are related to this. All of the panels that are being assessed through this landscape are really interdisciplinary, intersectoral platforms that have been designed by definition to enhance coordinations and engage with wider communities. What is the objective is to really provide a comprehensive response to priorities, to concerns, to knowledge gaps, as I was mentioning before. Engagement strategy, and that my colleague will explain a little more all the details about that, but you will see that there are different moments in time where it's the engagement with stakeholders and with member states as key, as well as, in a way, the opportunity to provide written inputs, but my colleague will be the one getting all of that. Maybe I will jump the roadmap until the last part, and we are proposing to have the launch of IPEA back to a big event. One option at this moment is the United Nations Environment Assembly that is happening in December in Nairobi, through a side event, and maybe through the Global Leaders Group meeting that will be the ones helping the launch of this, together with the Quadripartite, because it's our, in a way, mandate to do this. So now over to the next speaker, that will be Kefas. So over to you, Kefas.
Can you hear me?
Yes.
Okay, thank you very much, Jacqueline. So I think my task is just to take us through the roadmap for updating the Global Action Plan on AMR. As JP has indicated, one of the time-bound tasks that have been assigned in the political declaration to the Quadripartite. Next slide, please. So I think we are all familiar with this, in the sense that since the adoption of the Global Action Plan that is currently existing in May 2015 by the World Health Assembly, and subsequently endorsed or welcomed by the governing bodies of the other quadripartite organizations, namely FAO, WOA, and UNEA, there has been significant progress to date. 178 countries, as we know, have developed their own national action plans. A considerable proportion of them, about 68%, implementing these plans. And of those, 25% have costed the plans, and actually an associated M&E framework to these plans as well, which enables them to monitor their progress on a consistent basis. However, the challenge we all know, even leading up to the General Assembly high-level meeting last year that only about 10% of countries have allocated budget to effectively implement these plans in their countries. Now, this raises the bar and the need for action, which the political declaration or adopted by the 79th Assembly actually provided to us. And specifically, the paragraph number 25 requested the quadripartite organizations in consultation with member states to update the current global action plan. And the idea is to make it inclusive, multi-sectoral, and reinforcing the One Health approach, and also aligning with what is current and also the emerging priorities with regard to the global response to AMR. Next slide. So in order to see through this responsibility, the quadripartite has been working and consulting with many of you to ensure that we can successfully launch the process of the update to the Global Action Plan. We started with a roadmap, which was released on the 16th of April. And as you can see, this is on the Quadripartite Joint Secretariat website and accessible by scanning the QR code on your screen. Part of this roadmap defines the timelines and what should happen at each phase of this process. But an important part of it is an online survey that will also gather perspectives and contributions of all stakeholders in this process. Next slide. So some of the preliminary suggestions that we're already kind of having from some interactions and consultations informally with stakeholders did indicate that the gap as it is mostly relevant in terms of content. However, there is need for the update to address some critical lessons and gaps that have been identified, and also new developments. And some of the suggestions point to some very key areas, like the need for the gap to address accountable governance at all levels and strong coordination mechanisms. And then the need to address the environmental dimension of AMR in the gap. They need to highlight the role of diagnostics, laboratory capacity, surveillance systems across all the sectors, and they need also to reinforce the One Health that guides sector-specific strategies as well. But additionally, it also there is also suggestion that the gap needs to define specific funding mechanisms and other systemic issues like workforce development and systems that specifically should support effective implementation of the gap. Next. So in terms of process and timelines, we have in the roadmap that has been released outlined some specific process and some timestamps where we think we could have drafts for consultation. So this process has already begun with a landscape analysis being conducted internally within the quadripartite and associated with some evidence review and designing consultation tools to engage stakeholders in a consultation process to build the content that should inform the revision of the gap. And we are now in May, and we are due to launch this formal consultation with stakeholders and member states. There will be a first draft. We expect the initial consultation through the online survey will happen between the 1st of May and the end of May to 31st. And then we will have a first draft, hopefully in June or sometime around July. And then we will have member states consultation and stakeholder consultation also through a process which our colleague Junsha will outline. And then when we have the second draft, this will be subject to open public consultations as well as final global consultation with member states, leading to a final draft, hopefully by November, for submission to the process of adoption by the respective governing bodies of the Quadripartite. Next slide. So, like I did mention, the consultation process will begin using the online survey. This survey will go live on the 1st of May 2025, which will be next week, and it will close on the 31st of May 2025. And the participation of all of you is crucial. We envisage that this will not take a lot of your time, but we envisage between 60 to 120 minutes to complete the survey. And this survey, as you can see, also you can scan the QR code and it will lead you to the page. And it will cover essential parts of what needs to be updated in the global action plan, from the overall vision of the global action plan to the specifics of how the objectives should be reformulated or refined if necessary, to the technical content, and very importantly, to the framework for implementation, as well as the M&E for the global action plan. So this will be accessible from the 1st of May. It will open, and we hope that you will actively participate in it. And it will be announced also via several other platforms, including the multi-stakeholder partnership platform, but also all our websites. And perhaps our partners can also upload on their website, a redirect link on their own websites. Next slide. So what we expect when you receive the survey is to actually look at making your contribution, considering what major challenges are there, or what major changes and emerging issues are there that you are aware of and want the new GAP to consider. And also, you could also provide your suggestion to updating the vision, goal, and scope of the Global Action Plan, what you would like to see in the next generation of the GAP, and as well as the technical updates to the GAP strategic objectives, so that it reflects what is needed to actually drive the change that we require, and changes to the framework for action that actually outlines the critical roles played by various stakeholders in the implementation or in driving the action to be inspired by the Global Action Plan. And of course, there's room for you to provide any other suggestions that you would like to see in an updated Global Action Plan on AMR. On this note, I think I'll pass on to our colleague Junsha to outline the consultation processes.
Thank you, Kafes. Good morning, good afternoon, dear colleagues, friends, and experts. I will talk about the stakeholder engagement and also how the Quadripartite Joint Secretariat and the partnership platform will support and coordinate the consultation process. So we know that engaging stakeholders and securing the support and the buy-in are really critical, not only for the establishment of the panel and the updated GAP, also for effective functioning of the panel and the implementation of the GAP for the long run. So therefore, both the panel establishment and the GAP update will follow evidence-based, inclusive, and transparent processes. And the quadripartite organizations will lead consultation with stakeholders and the member states, ensuring broader engagement consensus, and the MSPP will be used as a main channel for multi-stakeholder engagement consultation for both process, for members and non-members. Next slide, please. So take an evidence panel as an example. Here just show how we are going to support and coordinate it. And here's showing the key timelines and activities for the panel establishment, engagement, and consultation. From April to May, the MSPP coordination team is currently conducting a stakeholder mapping exercise. It will leverage the existing stakeholders database, primarily the MSPP database, and draw on a network of partners and stakeholders from the 4 quadripartite organization to ensure a One Health approach and a balanced inclusion across all sectors, regions, and areas of expertise. So in the key stakeholders, actually it was mentioned in the UNGA declaration, including the governments, governmental organization, UN organizations, private sector, civil society, academia, research institution, and also underrepresented groups. For example, the youth, indigenous people, and grassroots organizations. So the mapping exercise aiming to identify the gaps, such as missing sectors, stakeholders, categories, regions, and area of expertise. From May to July, engagement strategy for IPEA will be developed and implemented based on the mapping exercise. A list of key events, opportunities will be identified. We try to use the best opportunity to engage with all the partners and stakeholders. And during May, we will launch the written consultation. So based on the questions, Jacqueline already presented the key questions. For example, what are the key functions, the key roles, and the modality, how to make it independent. So then following by the broader multi-stakeholder consultation. So before going to members consultation, we will have from May to September to organize inclusive multi-stakeholder consultation. We are aiming to organize 2 or 3 virtual consultation workshop and through in the MSPP platform. So then after that, we will go to broader member states consultation. This consultation will be led by the QGS Joint Secretariat. So until the launch of IPEA, as Jacqueline mentioned, could be UNIA, could be a side events global leaders group. So how to engage? The key activities of consultation is including intelligence gathering through online survey. And also we want to proactively outreach through maybe bilateral meetings, side events, and also engagement through major governing body events. For example, the WHA and the WOHA General Assembly and the FAO Council or Conference. We also want to actively engage with the group of friends, including the group of friends in Rome, in Geneva, and also in New York. Additionally, we may organize targeted individual and group interviews. So based on the expertise and select and also try to gather more in-depth insights. So finally, of course, we will also use digital communication, including the social media, help to increase the visibility and the inclusion of all the stakeholders. Try to make this process as inclusive as possible. For gap update, actually, we will follow the same pattern and the pathway. Thank you. I think I will hand over back to moderator, Javier.
Thank you very much, Junusia. Thank you very much, colleagues, and thank you everyone for joining this information session. So for the moment, I have 4 questions noted from the chat, and so I'm going to ask those to the different panelists. While others, you can keep writing the questions on the chat or even start raising your hand so that you can directly ask the question to the different panelists. So on the independent panel, Jacqueline, there is a question around industry. Which is the role of industry and if industry can be considered as a stakeholder for the independent panel? Over to you, Jacqueline.
Yes, no, thank you. Can you hear me?
Yes.
Yes, so I think it's very important to put context into this question, and if the question is referring to stakeholder for IPEA or if it is referring to a member of IPEA. Both of those things are to be defined, and that is what I was mentioning, part of the rules of engagement and how, in a way, the panel will operate itself. The existing panels, what they do, they have members, and it depends. Some of those are because they want to opt in. Some of them are universal members, and the members usually are the countries that belong to the panel. Stakeholders, on the other hand, are the group of the different scientists, industry, stakeholders, NGOs, civil society that participate and contribute to the development of reports. So it's a very important distinction about that. And if the question is stakeholder or member, it will depend on the rules of engagement. So over, hope it's clear.
Thank you very much, Jacqueline. To alternate between independent panel and global action plan, I'm going to jump into a question on the global action plan. For you, Kefas, should the survey be filled out from the point of view of singular experts or from a stakeholder organizations?
Yeah, thank you very much. This question from Ulrika. I think very, very relevant question because it is both actually can occur, but we encourage organizations to concretize their position and also complete the questionnaire as organizations. And in the questionnaire, you will select if you are completing the questionnaire on behalf of an organization or you are completing it on an individual capacity basis. So all these options are there, but for those, for organizations, we encourage them also to provide organizational perspective.
Thank you very much, Kefas. And now back to another question for Jacqueline. There were references made to the learning of useful lessons learned from existing scientific science policy panels. So the question is if this analysis has been written or is going to be written, and if so, when can it made available?
No, so thank you for the question. Yes, it's being written as we speak. The idea is to have it finalized by end of this month, but realistically it might be available by mid-May, and it will enter not a consultation process of the document, but it will serve as the sounding board for making the different qualities for the panel afterwards, the different functions, scope, characteristics. Over.
Thank you very much, Jacqueline. Another question on the Global Action Plan, Kefas, around the survey. If the electronic survey is going to be sent directly to the member states, or should the ministries access to it through the QR code that you put on the screen?
Yes, we will share this directly with member states. However, again, we'll make it publicly available, and it can also be accessed through the QR code. But the idea is that we ensure that member states also receive it, and they are able to provide their perspectives, and they can select in the questionnaire if they are responding as member states, and this will be a specific option to choose in the questionnaire as well.
Thank you very much, Kefas. Another question for Jacqueline on the independent panel. I think this is a question that has been asked or many people have in mind is who will host the independent panel? Jacqueline?
So, as per the the UNGA resolution, is the quadripartite that will host the panel. That's the expectations of how it will need to be established.
Thank you very much, Jacqueline. There is a question around the engagement. So, Junsia, if you can take that one, it's what is the plan to engage youth into the independent panel and the gap consultations?
Yeah, thank you. I think this to engaging with youth is very important. In our engagement plan, we already mentioned to focusing some underrepresented groups, including the youth. So we want to leverage, and a quadripartite, there's a youth working group. We want to work with youth working group and also to invite more youth group to join the partnership platform, because the partnership platform will be using as a main channel to engage with stakeholders. So, and including all surveys and also any other engagement strategies, we will have specific questions and go to youth. Yeah.
Thank you very much, Junsia. Another question on the Global Action Plan. Can more than one member of the same organization complete the survey? Kefas.
Yes, indeed. The survey is also designed in such a way that the response can be given based on, the discipline of the person. So, we don't all belong to one sector, and we want the multi-sectoral aspect of it to come out very clearly. Therefore, an organization can have people working in the health sector, people working in the animal health sector, agri-food, as well as the environment. So therefore, whatever expertise that the organizations can harness can actually be deployed in this process, so that we can have a very robust and really truly inclusive response to it, to inform a coherent updating of the gap.
Thank you, Kefas. There is a question, I do not know, maybe this one is for JP. There's a question about resource mobilization and support. What is the plan regarding global and national level resource support and mobilization for the implementation of the global and national action plans on AMR, including the support of risk communication and community engagement activities? I think this is related to another commitment from the UN political declaration, but JP, maybe you want to comment on that.
No, I mean, you're very right, Javier. I think, if you all recall the political declaration, there are specific commitments around financing. One is about mobilizing 100 million as a modest funding to catalyze the AMR response. But second is about leveraging the existing financial, let's say, resources, including domestic resources and external or development partners' resources, to include AMR into that. So there is no magic bullet really in terms of financing for AMR response. It's all about us being creative and or us reaching out, finding ways to speak to the Minister of Finances to ensure that AMR is taken as a part of the development agenda in all countries. But second as well, use the available external or donor funding to include the AMR critical interventions. Then the multi-partner trust fund that I spoke about in the beginning, it's also another funding vehicle. It's not going to solve all of these issues we're talking about, but you're also positioning it as a catalyzing funding or a catalyzer to make sure that we get more funding being channeled through it, and also to support especially the low-income countries to start or to be able to start some work around AMR. Back to you, Javier.
Thank you, JP. Another question on the Global Action Plan, Kefas, is what would be the information summary or synthesis process post the survey look like? Who will be involved in the analysis of this survey, and the output of this analysis, how it will be synthesized or summarized? Kefas, you are muted.
Sorry. So, very good question. The Quadripartite has established a core group comprising technical people from the 4 organizations that are coordinating this work. So we expect that the initial synthesis will be done by the Quadripartite, but of course, we will engage partners as as necessary. And the bottom line is we get a robust analysis of what is the outcome of this questionnaire, both quantitatively and qualitatively, to ensure that we can have the right material that fits into the revision of the gap. And this process will also be transparently shared, as has been indicated, that this is going to be an inclusive, co-creating, and transparent process.
Thank you very much, Kefas. Another question on the panel. It's how do you envisage the consultation process for the independent panel running? Will it be like a survey, like for the Global Action Plan?
I think it's Georgia, right?
Yes, or you, Jacqueline, or Tunisia, as you want.
Yeah.
True.
I think the current engagement plan, a stakeholder consultation plan, is very much aligned with Jacqueline presented the roadmap. So I think the whole process will be inclusive and also flexible, and building on the request, as we just mentioned, for example, for stakeholder engagement, and we are thinking 2 or 3 virtual workshops, but it can be adapted building on the roadmap. And also we will develop a survey, and during May, that is exactly like what Kefas mentioned for the gap. The similar survey will be coming out during May. Yeah.
Thank you very much, Tunisia. Jacqueline, I think this time is really for you on the independent panel. The question is, what is the plan to ensure that the work of the panel does not duplicate existing initiatives and organizations?
So, as I was mentioning in the presentation, there are 2 sides. One is the work that we are doing this year for the establishment of the panel, and that will at the end be a foundational document, or you can call it the guidance document for the panel. It's how it will be functioning. But besides that, the panel, to really be operational, needs to have other supporting or satellite documents attached to it. One of those documents is how to set priorities and how to establish the work program of the panel itself. So those type of documents and discussions need to describe very simply, in a very simple manner, what is the process for making priorities? What are the considerations that are needed for avoiding duplication? What do you have to have in mind to indicate in a way this needs to be done through this type of group or people or scientists, and that is to be further developed as well. Those documents might not be ready at the end of this year because the main and most important objective is to establish it. And any independent panel should have a voice in saying how they want to operate. So the question in here, how to avoid that, it will be because you will have to have a kind of guidance that the rules of engagement part of the things and how to do that. But that's for the panel itself to decide once established. Over.
Thank you very much, Jacqueline. And I see a hand raised, and I thank you for the hand because it will allow me to go through the list of questions. So please, Christopher Fern.
Thank you, Javier. Are you hearing me?
Yes, we can.
That's good. Okay. Well, congratulations on this information session, because I think it's extremely important, and I'm really glad that what I'm hearing is what I think is the right way towards achieving this. Of course, the IPEA is not the only deliverable that comes out of the United Nations high-level meeting resolution. But it's one of the more important ones, and it's the second time we're asking for this. So I think we cannot fail this time around. Now, of course, when it comes to membership, I don't want to preempt what will come out from the survey. But if I can just put my 1 cent in at this point, we need something which works. Yeah, so it's not just IPE. It's IPEA. The action part is the essential part. It's not just having a report. It's having a report which is implementable and which member states will want to implement. So the participation of member states, I think, is extremely important. Of course, it needs to be effective. So we don't want a panel which is, or a committee which is so cumbersome that nothing will happen, and just like what we've had now with the pandemic agreement, it takes 2 years just to agree on a text. So I think it has to be effective. But the balance is between effectiveness and inclusiveness. And at this point, and this is why I've raised my hand. At this point, I think we need to go towards inclusiveness. So I think we need to have as many member states, specifically member states, involved in this IPEA at this point. And then I think it will be part of the IPEA's responsibility to make itself effective and not cumbersome. So at this point, I think the balance should go towards being inclusive of member states, because that is, to my mind, the main way of getting member states to actually then implement what the IPEA comes up with. Thank you.
Thank you very much, Chris. And I'm going to continue with the questions. There is one that I think it's maybe for JP. It's because there are several around this topic, around the Global Action Plan, the National Action Plan, capacities, etc. And there is one about given the diverse capacities and context of member states, what measures is the quadripartite putting in place to guarantee equitable involvement and ownership of all countries, especially those with limited resources or in conflict, in the establishment of the independent panel and the Global Action Plan update?
Thank you. That's a valid point, and it's not only about involving them in the consultations. It's also about the panel when it's established, that it can serve them effectively. So I think, yes, it starts by the consultations, and as you have seen from the presentation that Jonshia and Kefas and Jacqueline have made, we want really to be open. We will have more of this kind of meetings. We'll use all the tools available. Our website will still be updated, and we'll listen to you. We'll send you your email address, and then you can send your views on this. However, we also, for the GAP, for example, the consultation will also be regional level. So we'll have following different regions come to the member states and discuss with them about the GAP. For the independent panel as well, we'll have the multi-stakeholder partnership platform as the big vehicle, but will not avoid any other way of reaching out. It could also be written suggestions that we receive from many stakeholders. And as Chris also mentioned, we'll make sure that member states do own this process. And when we talk about member states, trust really the quadripartite, we think about all the member states, and we understand they have different capacities. And the best way actually to look into this, you try to benchmark yourself to the least capacitated member states so that you can evaluate if you have reached all of them. So if we're going to organize things, let's say physical meetings, we'll have to make sure that we have support and financial support mainly to support the member states, which will need to be supported. However, we want also to, again, balance the expectations. We are not very well supported or financed to conduct all of this. So we also argue and urge that member states should really support us, and member states should also prioritize this to make sure that your missions in Geneva, in Rome, Paris, Nairobi, whoever is there in the missions really get well connected to the capitals and provide feedback at any time we are seeking those feedback or those inputs from the member states. So we all have to work together. We'll do our best to make sure that the information is very inclusive and transparent and reaches everyone. But we need as well the member states to do their own homework to really get engaged and use all the means to reach out to us and contribute as much as they can. Back to you, Javier.
Thank you very much, JP. There is another question in the chat about the independent panel, and it's a long statement. Let me try to summarize it without losing the content and the meaning. But basically, it's saying that the ideas for an independent panel were already formulated in 2019 by the interagency coordination group. There was a draft of the terms of reference for such panel. There were some indications like the installment of a WHO advisory group in 2020 to ensure scientific progress. So the question is, are any of these efforts incorporated in the current reflection about the independent panel?
So the simple answer is yes. All of the different elements that were discussed and in a way submitted by the interagency coordinating group are being considered. Having said that, there were also options in the TORs. There was some room for better clarifications, and this is why we need to go a step beyond. The WHO advisory group in 2020, that has not been fully considered, particularly because of the One Health approach and thinking on how to follow up on scientific progress. But I can guarantee that the guidance that was provided by the IACG is being fully taken into account. Thank you.
Thank you very much, Jacqueline. Kefas, there is a question on the chat about the Global Action Plan survey, and this specific question is saying if we have any plans to include the communities, households, farmers, etc. in the survey.
Yes, indeed. This survey is open to all, and first of all, we as Quadripartite, we intend to facilitate the wide dissemination of this via our networks. However, as Junshia has also outlined in the process involving the multi-stakeholder partnership platform, we expect also the civil society and other clusters to be able to disseminate widely to key stakeholders, including farmers, and also including youth groups, patient groups, and so on, to be able to have these broad perspectives from all our stakeholders. So this will be promoted also through communications from the Quadripartite, which will be regular to encourage people also to complete this this survey.
Thank you very much, Kefas. Going back to the independent panel, I think I have the answer, but Jacqueline, I will pass the question on to you there. It's a very simple question that I think is still in the process, but it's what are the differences and similarities between IPCC and the future independent panel on evidence? Knowing that we are defining it, cannot say
So
much.
go ahead.
No, just
Yes, you are more than a facilitator. You are part of the core group thinking, so go ahead. And I feel very comfortable with you answering.
Now, on this question, my answer would be, as we are defining it, we cannot really answer the question on similarities and differences, but definitely the IPCC is one of the panels that is taken as a model, as well as others, as part of this lessons learned exercise that it was mentioned during the presentation and on which we have already provided some insights. So the differences and similarities, I would say we have to wait to the end of this process in consultation with everyone and taking everyone the goods and the bads of things that you can also see, the one asking the question that you can see also on the IPCC, so that we can define this panel in consultation with everyone. Jumping into another one, Jacqueline, I can also support you in the answer, but I would like you to take it. It's a follow-up of a statement made before. I'm reading it as it was stated. For the independent panel on evidence that to be truly independent, wouldn't it make more sense to have it housed outside of the Quadripartite? wouldn't there be perceived as a conflict of interest? And should the future evidence point to one of the four sectors contributing to rather than mitigating AMR?
So I think here we need to also go a little more in depth in what the word independent means. And what the word independent means is really bringing the science that it is top-notch into the discussions and preparing or developing the assessments, the reports, the horizon scanning, the different things that are needed using that independent science, that it's also being reflected through members that are independent members. That doesn't mean that everything needs to be outside one or the other organization. We have a huge amount of different experiences that I can cite you. So IPCC is independent, IPCC is intergovernmental, and it's hosted by WMO and by UNEP, for example. IPBES is independent, is intergovernmental, it produces science that is considered not biased, both of them, and it's hosted by UNEP, for example. Then we have IRP, International Resource Panel, exactly the same, with differences in membership, with differences maybe in the way they approach the topics, but all of them have a process to select the people that will be developing the reports, the assessments, the different data sets that might be selected in an independent manner. So that's the way to guarantee the independence. Having said that, the important area in here is also the uptake, and I'll refer maybe to the first person that spoke without not being as the quadripartite organizations was very sharp in saying that we really need to move things not only fast and good and quickly, but the uptake of those deliverables or of the things that the science is putting on the tables needs to be having into the action, the IPEA, the word action in the name of the panel. And that's key here. And that's something that can be brought, and that's the power of the UN organizations if we host the panel. It brings that ownership and that accountability for moving things forward in the smooth manner, authoritative, non-prescriptive, and all of the other things that we were mentioning before. But you can add, Javier. I feel comfortable listening to you as well.
No, as you said, and we have discussed that many times, independency, it has to relate to the science and how the science is brought into the policy making, part. And I think.
So yeah, I mean.
Go ahead.
Just, no, I mean, it also goes with the next question you have on the chart, Javier. I think there's also, I think, a mix-up between, hosting the IPA and governance of IPA, because these are two different things, right? So it's not like if it's hosted by the quadripartite, any of the quadripartite or quadripartite together, that, it's going to be serving one sector versus the other, but it's going to be influenced by the governing body of WHO or WUHA or FAO or UNEP. I think it will have, as Jacqueline said, it has to be independent in terms of science, right? But it has to be authoritative and drive the action, as Chris also brought it on our discussion. So the governance of structure of the IPA has to be thought in a way that it's going to really fulfill those roles, to allow the independent panel to be independent in terms of how they manage science and evidence, but also the governance that gives it, the legitimacy to really drive the action. So it's not going to be necessarily what we know so far as the current governance, governing bodies of the quadripartite. It's very good. It's going to be different. The governance of the IPA is going to be different to the governance of the quadripartite. And again, we're not decided. We're not making any concrete final decision here. We're just going to be open up to discuss all of this with you in a consultative process. But we want to really make sure that we all understand on these basic principles about the independence of science and also the governance that gives the IPA a power or not use the power, but really the leverage to influence the action as well. Back to you, Javi. I don't know if we still have time to go, but I see this as very interesting info session. I think we could have given it longer or even planned for maybe next ones very soon. Thank you.
No, thank you very much, JP. There are several questions on the chat, but they do not really relate to the update of the Global Action Plan, even though they are related in terms of what's the role of the Global Action Plan and the national action plans, the implementation, the actions that should be prioritized. In those elements, I would invite those people to, I would say, ask those questions by filling the survey, so that we can also clarify a little bit more what's the role of the Global Action Plan and the connection with the national action plans. Having said that, I do not see any more questions on the chat. I do not see any more hands raised. So I think I'm going to give it back to you, JP, for the closing remarks.
Thank you. I'll not be too long. First, thanks to our participants. Thank you for showing up. Thank you for interacting with us. And thanks to our moderator, Javier, very good job. And to our speakers. Someone who has not been on the screen, but who did an amazing work is Nilea, who is also with us. And thanks for good work, Nilea, wherever you were. And Shota as well. So, some people from the Secretariat were not shown on the screen, but did an amazing job putting this together. Now, we want you to be involved. We want you to give us those good ideas. We want you to participate in decision-making as we update the gap and as we establish an independent panel. So we're going to keep doing this and watch our website. We'll also be actively communicating with you. We stay with your contacts, the emails. We can send you emails with updates. And there will be this survey. Please respond to the survey really in good numbers. I think the political declaration has been a great milestone of last year, but the gap, the Global Action Plan is going to lead us for the next decade. So we need to pay attention to the Global Action Plan. The independent panel, once it's well established and properly given the right foundation, it's going as well to really boost our governance structures for AMR and drive the action to be able to address AMR in an effective way. So we want you to be involved, and we'll keep in touch, and we'll organize similar sessions in the future, and we'll also organize other ways of getting your feedback in the process. Thank you so much, everyone, and have the rest of your day well enjoyed, and or if it's work, keep doing the right thing and the good things. Stay in touch. Thank you.